welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Shruti Singal. She is an emergency physician and healthcare executive. Her KevinMD article is titled Virtual Care is Convenient, but is it better for everyone? Shruti, welcome to the show.
Thank you. Happy to be here.
We'll get into the article in a little bit, but first off, just share your story and journey to where you are today.
Yeah, I'm happy to. So, an emergency medicine physician by training, worked at Emory until probably about mid 2018. Had some thoughts sort of going into 2017 about just next steps. I love my job. I love seeing patients, but really wanted to sort of explore my options. Went on to work at Anthem Blue Cross Blue Shield here in Georgia, which is where I still am, and in Georgia. And then got my MBA at Georgia Tech and started to sort of see that business side of life, and wanted to really use the skills I had learned and combine them with, of course, my clinical background, and went on to work at First Choice Health. I've been here for almost 2 years, and I'm their chief medical officer.
Tell me about that transition from clinical medicine to industry. What was that like?
Yeah, so I actually did it slowly. I started at Anthem Blue Cross Blue Shield end of 2017, and I continued to work about a shift a month because I had heard sort of some horror stories about people moving over and then going, oh my gosh, no, this isn't what I wanted. I was really pleased with sort of how I felt, even after like the first month, because I think the first 6 months was such a challenge, and I've been doing the same thing for about 20 years.
Yeah.
And so I think there was that excitement of learning something new and putting my skills and using them in a way that I had never done. And I think being really an ER doc, my job had been so focused on just one thing where I didn't get to really learn about sort of other parts of the hospital or owning my own business, like a private, practice doc. So it really sort of opened up my eyes to how much was out there for all of us.
Now, for those other clinicians who may be listening to this podcast and interested in making that transition outside of clinical medicine, you mentioned you did get an MBA. Is MBA necessary to make that transition?
It's always hard to answer a question like that after you've gotten one, because you're like, well, did it help? So it's a good question. I think about it a lot. My transition initially out of ER was without an MBA. And what had happened was I realized that even though the first 6 months of that initial job was super challenging and there was a lot to do, the job changed, the role changed. And I realized that it started to become a little bit common day to day. And so I was like, well, what do I do to add to my skill set, challenge myself? I thought about a lot of different things, and I really just honed in on that MBA. I'm in a city with a lot of good universities. But what I will say is this next transition, so what I do now, I think the MBA was imperative for me because I didn't have that business background. But again, I think if you've owned your own business, if you've done other things throughout your career, it may not be as important.
Now, through your journey so far, what would you say is the number one tip you could share with clinicians who may be interested in following your footsteps?
That's a good question. So I think this sounds really trite, but take the risk, do it. Because I think that if you're feeling that at all, I've been feeling it on and off for about 10 years. And I met somebody along the way that had been non-clinical for a bit. And she really pushed me to talk to somebody who worked with physicians and help them create a resume and not a CV. And for me, that was the turning point in finding a career outside of clinical medicine. So I guess I'm answering my crazy thoughts is find a person to help you with that transition for your CV to a resume and really understand what that looks like. Because all of us, I think, have always done a CV. It's very based on our papers and what we do with all of that. And then you realize, oh no, like that's not important in this situation. It's that clinical knowledge, yes, but that understanding of what you're going to do with it is going to be very different.
So just to be clear, what is the difference between a resume and a CV?
Really, a lot of it's just words. I mean, it was so interesting to speak to the person I spoke to, because he's like, you have to have certain words in your resume that you typically wouldn't have in your CV because of exactly of what we do when we see patients and what's important. Maybe it's, the papers we've written, maybe it's, whatever those things are that make us really good clinicians, sometimes don't translate in that world of industry, whatever that is. And so I think it's really understanding, first of all, what industry you want to go into, because I didn't know when I first thought about what do I want to do. I'll be honest, I had no clue what was out there. I had no idea. And it wasn't until I spoke to somebody who was not really fully clinical anymore.
Mhm.
And she's like, well, what do you want to do? And I was like, are there a lot of options? And there actually were a lot of options. And I think we're really lucky in that, as the years go by, there's actually more and more options for us.
All right, let's transition into your KevinMD article. It was written back in April. It's titled, Virtual Care is Convenient, but Is It Better for Everyone? Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah. So, I mean, we all know COVID happened, and it seemed like, and I did this as well, but it seemed like a lot of people went on to, I'm talking about the clinician side, working for companies as their physicians for telemedicine, or they were getting onto different sites and seeing their own patients via some kind of video. Just seemed like it was everywhere. And it was so important during COVID because of access and people not wanting to leave the house, or they couldn't, or they were quarantining or whatever. So it was so important and so necessary. But I started to feel like it was the only solution that was really being discussed. And we were trying to fit everything into the box of just virtual health. And it got me really nervous because, for all of us that have trained and worked for years and years and years, seeing patients, touching patients, I was like, there's got to be a line. There's got to be a point either in the journey of that healthcare where you know that you need to send the patient to be seen in person, or are there certain people that just aren't going to, it's just not going to be enough for them. And how do we figure that out as clinicians and see those small, maybe nuances of how the visit's going to know, well, this isn't working for this patient. And I think it's really hard, and I alluded to this, is that we really need access for behavioral health and mental health. But I think sometimes those are the times where that connection can't be made because of just that personality. It's not, I think it's just person dependent and, provider dependent. And so that's really what I think I was trying to drive at with that article.
So, if virtual care isn't for everyone, what are the other pathways that we can pursue? What are some of the other options?
Yeah, I mean, I think that's the big question. So I think that I actually worked for chat-based healthcare. I think there's that for people who are really probably on the other end that maybe lose that connection because they don't want to be on video. So I definitely think there's that. I mean, I think we still always will have phone calls and things like that. But I think for some people, it's going to be going in.
Hmm.
And again, I don't think that it even means that you have to go in for every visit. I think about behavioral health, mental health. Sometimes you have to create that relationship with an in-person visit, and then you can transition to virtual care. So I think it's just understanding and being able to not put everybody in the same box is really what I'm thinking about for the future in terms of telemedicine.
So, I've talked to some psychiatrists who say that telemedicine or virtual care is actually a boon to them because they're able to give them access, whereas otherwise they couldn't, because as you know, there's such a shortage of behavioral health clinicians. So how do you resolve that tension? Because I'm hearing kind of both, and I understand what you're saying about how virtual care, you can't build that in-person relationship through virtual care, especially in behavioral health conditions where that relationship is really needed. How do you resolve that tension?
Yeah, I totally agree with you with that. I think that's what makes that the stickiest of all, because of the access issues and also because of just how much we need it. I feel like the need for those that practice in that field has just grown so much, to the point where, as you know, there's so many apps and so many different
Hmm.
things, starting with coaches and, sort of that journey, that patient journey of like, okay, somebody that's more available all the way up to, how do we then slowly get them to see the psychiatrist. So, I think it's just knowing your patients. And I think that's the beauty of it is that I do think that most practitioners, most providers, most psychiatrists, I do think that they know when somebody isn't being reached. I always wonder if it's actually the sort of the coach level and the level above it, whatever that is based on the app. I worry about those levels of really being able to filter the patients upwards as needed. And then eventually, like we talked about, figuring out who does need some kind of in-person visit. And I think it's actually probably the younger generation. Sometimes that is hard to engage anyways, whether it's via Zoom or otherwise. And I think the people that want to engage and want to see somebody for whatever they're feeling, their anxiety, their depression, I think they're going to look for that engagement anywhere. So I think a lot of times it's going to be a constant tension.
So going forward, where do you see virtual health's role in the next year or so?
Well, I hope it doesn't go away because I think it's absolutely necessary. I really am concerned because I actually think that overall virtual care usage has gone way down.
Yeah.
And so that means people are back in the offices and doing all of that. And, and I'm sure you know this as well. I am just shocked at how hard it is to get an appointment these days. You want to see somebody, you may be 3-6 months out. Somebody told me the other day that the next appointment for whatever they were looking at was 2023. And so we definitely need to keep virtual care around. It's so important for access, streamlining what goes into the doctor's office and all of those other things. But I think it's just being able to suss out what belongs there and what doesn't, and transitioning people one way or the other, depending on where they are. I know I haven't really used a lot of virtual care. Granted, maybe I'm also not in the doctor's office that much, but it hasn't really become part of my daily life. How do we change that? Is it in education? How do we get people to use it for the little things and sort of keep the doctor's offices there for the things that, like I mentioned, really should be in the doctor's office? And, we say the same thing in the ER for all those years, is how do we get the people in the ER that need to be there and keep everybody else where their place of service should be?
No, I definitely understand what you're saying, because I have patients, I'm in primary care internal medicine, who would rather wait 6 months to see me in person than see me like next week for a virtual visit or the next day for a virtual visit.
Yeah, that's I think, and it's just human behavior, and it goes back to sort of some people just really need to be in the office, need you to see them, they need to see you. But I totally agree. And, I'll be honest with you, the couple times that I've called to make an appointment, I haven't been offered a virtual visit. And so it makes you wonder, like, what is that back and forth education around virtual visits? And in some cases, should that be the only option, so that people are kind of forced to at least start off there, and then it's the decision making of the physician on why don't you just go ahead and come in, and so it leads to a triage almost.
Now, you mentioned behavioral health as one area where virtual care may not be for everyone. Any other conditions or areas where you feel that virtual care may not be suitable?
I think it's best used for primary care. I think any kind of problem where like my husband's an eye doctor, he's an ophthalmologist. It's just not that easy. Everything they do is really, really technical. I really think it works great for primary care. I have this one thing wrong, or, what I think would typically go to a really quick visit in the office, or something that would go to the urgent care. I think that's that first layer that I think about that does really, really well on virtual care. And like I said, I think that behavioral health can do well as long as those nuances are picked up. And when things just aren't, there's just no engagement, and you can sort of move on from that and figure out another way.
We're talking to Shruti Singal. She is an emergency physician and healthcare executive. Her KevinMD article is titled "Virtual Care is Convenient, but is it better for everyone?" Shruti, what are some of your take-home messages that you want to leave with the KevinMD audience?
Well, one of the things that I thought about when you and I connected earlier was what is driving my passion these days, and what's top of mind. And working at TPA, one of the big things I I think about are the providers. And before that, being at a, in a payer, it was really typically about the members. And so it's been a really interesting transition for me thinking about the providers. So I would say top of mind, or sort of what I'm thinking about these days, is really how do we get providers giving the members or the patients the care they need, without a lot of oversight by a third party or an insurance company, or in our case, a TPA. So, maybe not a word of wisdom or anything really crazy, but just that I think that that's really top of mind for me, and something I'd love to talk about another day, but just prior auth. How is that affecting, end users, or really the patients, which is all of us, and what does that mean for our physicians and our members and the overall cost of healthcare?
Shruti, thank you so much for sharing your time and insight.
Thank you.
Thanks again for being on the show.
Thank you. Take care.